let's talk about sphenoid bone. Okay, so sphenoid bone is a very important keystone bone of the skull because it is located in the middle cranial fossa. Okay, so we have the anterior cranial fossa, the middle cranial fossa, and the posterior cranial fossa. So the sphenoid bone is situated in the middle cranial fossa, and it is one of the keystone bone of the skull because you see it articulates with almost all the other skull bones. Okay, see here it articulates with the temporal bone, the frontal bone, the parietal bone, and also it articulates with the zygoma, the zygomatic bone, and the maxillary bone. And here, if you see, it articulates again with the occipital bone and the temporal and the frontal bones. So literally it articulates or communicates with all the other skull bones. Okay, so if you take a look at the sphenoid bone, it is a single unpaired bone. So you don't see two pairs like a few other skull bones. It is a single unpaired bone and located in the middle cranial fossa. So if you move on to the other views of the sphenoid bone, we have four views. So when I look from the front, it is anterior. When I look from the back, it is posterior. When I look from the away from the midline, lateral, towards the midline, it's medial. Above is superior, below is inferior. So these are all the few views which you should get used to in anatomy. Okay. Now, if you take a look at the anterior view, I'll tell you a few very important structures in sphenoid. Okay. See a small wing-like structure which ends here, and again it goes and comes here, right? Similarly, you see on the other side a small wing which ends here and it goes like this, right? That is called as the lesser wing of sphenoid. On the other hand, you see a big wing here, so it goes around like this and comes here. Similarly, on the other side, right? So it goes around and comes like this. That is called as the greater wing of sphenoid. Okay, so we have two wings. This is the lesser wing, and this is the greater wing of sphenoid. Very clear, very easy, right? Okay. Now you see here, it is it looks like a foramen, but it is longer and narrower than a foramen. So any cleft which is longer and narrower than a foramen is called as the fissure. Okay, so this is the superior orbital fissure. Okay, so we have a superior orbital fissure in the sphenoid bone. It is a very important cleft because there will be cranial nerve 3, cranial nerve 4, and the first division of the trigeminal nerve, which is nothing but the ophthalmic division of the trigeminal nerve. And also there is going to be superior ophthalmic vein passing through the superior orbital fissure. Okay, so it is one of the very important landmark or a feature of sphenoid bone. Okay, now superior orbital fissure, you see a beautiful round structure here, right? So you can visualize on the other side. Okay, so this round structure has the name, it is rotundum. It is foramen rotundum, and this foramen rotundum carries maxillary nerve. And below the foramen rotundum, I see oval structure here. Okay, this is foramen ovale. Mandibular nerve passes through it. So in general, maxilla is above, mandible is below. Similarly, rotundum is above and ovale is below. Rotundum will be round and ovale will be somewhat oval in shape. Okay, and in this posterior view, you see another foramen here, right? You visualize on the other side. This is foramen spinosum. Okay. Now, an important canal also passes through the sphenoid bone, which is nothing but the optic canal. Okay, so you see a beautiful canal here. This is the optic canal, right? So if you want to look at from the superior view, this canal. Okay, so that is the optic canal where the optic nerve and the ophthalmic artery passes through it. Okay, now moving on to the other structures. So you see a beautiful process here, right? That is called as the pterygoid process. That is called as pterygoid process. So as I said, anything which is towards the midline is medial, anything which is away from the midline is lateral. So this is medial lateral pterygoid process. Sorry, this is lateral pterygoid process. That is medial pterygoid process, and this is lateral pterygoid process. So what is the significance of a pterygoid process? It gives attachment to muscles. Okay, so you see this portion is called as pterygoid hamulus. Pterygoid hamulus is very important because the pterygomandibular raphe, it wraps around it. Superiorly, the pterygomandibular raphe extends to the pterygoid hamulus, and then inferiorly to the mylohyoid line. Okay, so I just erased it for your view. So the pterygoid process has a pterygoid fossa in it. So pterygoid fossa, the medial pterygoid muscle passes through it, and also it gives attachment to the tensor valley palatinius. Okay, so we have the medial pterygoid process and the lateral pterygoid process. Fine. Okay. Now, another very important landmark or a feature of a sphenoid bone is this area. Okay. So this is the body of the sphenoid. So the sphenoid bone has a body, a lesser wing, and a greater wing. So the body of the sphenoid bone, if you see, it has a very important gland in it. Okay. So this depression is the hypophyseal fossa. So this hypophyseal fossa, it has what is called as the sella turcica or sella tertia. It has the sella tertia. This sella tertia is nothing but it is the one that houses the pituitary gland. So the pituitary gland is located in the hypophyseal fossa. So you see a knot and horn like thing, right? This is the clinoid process. Okay, so these are all the few very important structures in the sphenoid bone which you should know. And this sphenoid bone also has a sinus, which is nothing but the sphenoidal sinus, which is supplied by the posterior ethmoidal nerve and the pharyngeal branch of pterygopalatine ganglion, which are nothing but the first and the second division of the trigeminal nerves. Okay, so this is what about the sphenoid bone. So I hope it makes sense. Thank you so much for watching the video. Have a nice day.